Hey there, guys. Between Two Teeth, we usually don't talk about teeth, but today you're in for a special treat. We're talking about teeth, we're talking about oral maxillofacial surgery and periodontics with our good friend from the podcast Everyday Oral Surgery, Dr. Grant Stuckey. Please give a listen. Ask a
I know
question.
Grant
I'm
is
surprised
so nice.
that I
Go
can't
for it.
believe he keeps inviting us back on the podcast because we just talk.
No, you guys have brought up a lot of good points, I think.
Grant's like, dear diary.
It's like the shotgun approach. You guys just blast me with all
That's
these
what we
ideas.
do.
and I'm
Have we
trying
had
to-
a lot of caffeine this morning? Yes.
No, but I think so. You're kind of touching and dancing around some of the awkward situations, and I think in your setting, it's much more fluid because let's say maybe Bob owns the practice and he brings Stephanie in. And so he's motivated from the beginning to get along with her and kind of make this work and understand what's going on. I think in a setting maybe like I've been in, and I think a lot of guys are going into, is they're just joining a practice and then a periodontist. They're both independent contractors, and they kind of start bristling at each other really over the overlapping procedures, like basically bone grafting and implants. And I think it's very unfortunate that that small area of our practice has to create such a divide for us because, if we didn't have overlap, it would be very easy. Because I can call my orthodontist and say, hey, what do you think about this case? Blah, blah, blah. There's no threat there. There's no issues. But like you're saying, in a DSO, when a patient comes into practice, all of a sudden it's this big whole competing situation of like, well, why are you sending him to perio? And then perio, why are you sending it to OS? And in our case, it's like, okay, the oral surgeon has more schooling. I can sedate the patient. I can do X, Y, and Z better. And then the periodontist has their argument. Well, I do soft tissue better. I do suturing better. I do this. And we're like, everyone's fighting over these patients. And it can get pretty just ridiculous. And we start overlooking the strengths of each person. And so I like what you guys are saying about how you work together.
And Grant, you brought up, bristling. I love that word selection because that's a real nice way to put frustration at its deepest level. You just get out of residency, you're supposed to be the surgeon, and now you've got this, and with all due respect to Perry, you have this JV person around who's kind of putting a thorn in your side to say, no, actually, I'm here and I should be the expert. And especially as independent contractors, you guys both you kind of eat what you kill. And where I think it could be set up better to help both specialists out is for whoever owns the practice to look at the practice model and say, can we afford two surgeons here? And it's just because they're both going to place implants. They're going to both sedate patients. There are, perhaps wisdom teeth is something that is going to be in the oral surgeon's realm. But you have a lot of periodontists that are making arguments that say, hey, I do take out wisdom teeth. I do place implants. I do suture. I do have the soft tissues. And so as you have these corporate organizations start to learn from kind of past personnel miscues, I think the question they should be asking themselves is, is there enough things to do for two surgeons in the building and create that environment?
Sure.
Well, and I think as I hear Grant talk, there's some financial disincentives to work together in what you're talking about. I think from a corporate entity perspective, you want your staffing, including your surgeons, to be able to have appropriate relationships. What I thought about as well, at the end of the day, ethically, as professionals, we have the obligation to really put the patient's best interests paramount. And it also gets into risk mitigation and risk management. I'm on the state board here in Texas and see a whole lot of untoward events in all sorts of areas. And a DSO does not want bad outcomes for patient satisfaction or hospitalizations or having to redo stuff. But there's a level of nuance there that gets tricky. And ego and money, money, power, and relationships control so many things. And to Grant's point, we've kind of backtracked a little bit on that in our own type of practice. And maybe it's a way of revenue sharing as a DSO looks at the surgical providers and say, okay, we're going to have a little bit of a different structure where you guys, the two of you or three or four, compete in some things, but there may be a revenue share model that is a little different to encourage people to work together.
I like what you're saying there, Bobby. And it's almost treat them as two, it's almost like two siblings. And if mom and dad favors
siblings
one,
never
it's
fight.
it's just not going to be,
Right.
You can choose the type of relationship you want with your sibling.
Yeah.
And it doesn't mean you both don't have your space to shine. It's,
Well, and to Steph's point too, there's a continual evolution. The only thing that's constant is change. And I think for OMS, I think especially in the past couple of years, the leaders have sort of appreciated we can't have ourselves on an island. And we are best served when people look at us as we want to be part of a solution. And that's going to mean working with other people. Steph and I were invited to the dental implant conference through Amos a couple of years ago. We're actually giving 2 talks at the Amos annual session coming up. One on communication and effectiveness. The other one's actually on kind of well-being. Amos, through Dr. Paul Schwartz, has been very involved in sort of the well-being initiative and working with the ADA.
Dr. Schwartz is amazing. He was one of the first people that kind of came up to me and at Amos and was like, hey, we want to work better together.
Yeah, he likes you better than me. He goes, where's Steph? Is Steph here? He's one of our subscribers on Between Two Teeth.
And what Dr. Schwartz kind of taught me in that moment was that to work with somebody else, especially when you have 2 big egos involved, man, and it's kind of changed how I look at things too, based on his example, is just you have to give respect to get respect. And it's a tough lesson for me. I'm not great at giving the respect, and so I don't get a lot of it. But I've tried to change where I try to give more respect at the outset, even though, I may not feel complete or fully fulfilled. And I really try to go out on a limb a little earlier than I used to try to, just lay the groundwork of goodwill. And yeah, it doesn't come back every time, but a lot of times it does.
Here's the deal. This is one of the things I learned. I did a public policy fellowship at Harvard Kennedy School a couple of years ago. And one of the professors, fantastic guy, was a presidential advisor for 4 different presidents, is like, you can be the smartest person in the room, but you may not be the most effective. And figuring out how to be effective. And yes, it's managing your ego. It's managing other people's egos. It's building goodwill. I think we need to write a manual for how a periodontist and an OMS can get along. Or you just wrote something on Substack. Is that what that was?
Like that.
I'd love to hear Grant's take.
We'll charge $1 for it. Can we charge money on Substack?
You can, yeah.
Oh, well, we should. Maybe $2.
Sounds like a riveting article or book.
Well, and I think,
Jeez.
Grant, you
Tell
help.
all.
Well, riveting. That's probably that's a strong word.
Yeah.
It'll be different. We will say that.
Yes.
But I guess a whole lot of life. I think. People try to find happiness. Our push with Between Two Teeth is sort of well-being and living a life best lived. There's, I don't like the term happiness because there's times you can't be happy. You're in an environment, with doing everything that we do, there's times that things are not happy at all. So I try to strive for peace because I think that's more important. And a lot of that peace can be determined by the differential, the delta between expectations and reality. And knowing that for an OMS and a perio to work together, you should expect there's going to be times of disagreement. Period. I can probably end it there. But there's also times that you're really going to work well together.
And again, I'd love to get Grant's take on some of the stuff we've been talking about.
He thinks we're making it all up, I think. What do you think, Grant?
Yeah, I think no, there's a couple of things you guys have said I really like. One was Steph's comment about kind of getting to know the other person, seeing what they do, even observing and shadowing them. I think if they're willing to do that is awesome, and it could be a great thing. I like, similar to what you were saying, how you learned from her with the suturing type stuff. I think that is so important for us, and I would guess it's usually the periodontist is more open to learning from the oral surgeon, and unfortunately, it's much more harder for the oral surgeon to learn from the periodontist because we have this unfortunate chip on our shoulder where we say, "Hey, I went to more schooling. I did, more intense cases. I did all this stuff, and what do I have to learn from a periodontist?" Right? It's this unfortunate mental block we have, and I feel the same way. Like after I got over that block, it took me a couple of years. I started calling and talking to some periodontists I realized were like, wow, they have good results, and how are they doing this, and what's going on? And I started getting this new respect for one in particular, who's a friend of mine. And all of a sudden, it turned from like an enemy to like a mentor. And I think there's a lot to be learned, like you're saying, and it's unfortunate that we can sometimes have a mental block and ego can get in the way.
Grant, that's